for today, Ms. Gina Lucas and Melissa Cotton.
Hi everyone, welcome to our presentation, Falls Are Preventable. This is part 1 of 5 for our Show Me Healthy Aging webinar, and we are so excited that you're here with us today. My name is Melissa Cotton. I'm a nutrition and health education specialist for the University of Missouri Extension in Jackson County. And joining me in the facilitation of today's presentation is my colleague, Gina Lucas. Gina is also a nutrition and health specialist, and she is headquartered in Andrew County in the northwest region of the state. And we are both very excited to be joined with 3 special guests, Charlotte Faust, Diane Hall, and Marissa Sandboth. And I will be introducing them a little bit more in detail further on in the program. So this series was intentionally planned for this week as it happens to be Falls Prevention Awareness Week. So every September on the first day of fall, the National Council on Aging, or the NCOA, sponsors Fall Prevention Week. And states are encouraged to host and promote falls prevention awareness and screening activities to draw attention to the problem and offer adults practical solutions. And we are going to enter the link to that event page in the chat so you can go directly to that part of the NCOA's website to learn more. The NCOA leads the National Falls Prevention Resource Center, raising awareness and supporting educational efforts regarding falls, as well as promoting evidence-based fall prevention programs and strategies throughout the U.S. And to learn more about what the NCOA does, you can visit their webpage at www.ncoa.org. So here at the University of Missouri Extension, we know that falls and the fear of falling are a serious and common issue that people are facing. And according to the U.S. Centers for Disease Control and Prevention, 1 in 4 Americans age 65 and older fall each year. About every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult dies from a fall. Falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions among older adults. And so that's why we have put this webinar series together, Show Me Healthy Aging. We want to bring awareness to the issue of falling and the fear of falling, and to share information about resources in our communities. We also want to help connect people to those practical solutions. So we have lots of great information to share with you today and the rest of the week. So don't miss out on topics like staying active, home safety, maintaining brain health, and medications. And you will use the same link that you used today to attend those other sessions. So with that, I would like to turn the program to our guest speakers. We're really happy to hear about the different organizations that they represent and learn more about the resources that they offer to the community. So up first, we have Charlotte Faust. Charlotte is a family caregiver coordinator with the Area Agency on Aging. Charlotte, thank you so much for joining us today. I'm going to turn it over to you, and you just let me know when you're ready for me to advance the slides.
Thank you, Melissa. So if you'll go to the first slide, please. Okay, so a little bit of history about the area agencies on aging across the state. We were created in 1965 when Congress signed the Older Americans Act, and Lyndon Johnson signed it into law. It created the eligibility for these programs and the goals, and also talked a little bit about the funding. The eligibility is, for these programs, everyone has to be over the age of 60. And for certain programs, they either have to be homebound or they have to be a caregiver living with the care recipient. And we'll get into that a little bit later on. But the funding, the Older Americans Act established the funding for our programs. And the big chunk of it is the nutrition program, which is more commonly known as Meals on Wheels. But we are a part of that. And so we do deliver meals to seniors who are homebound and over the age of 60. The sad news is that we are the smallest area agency on aging across the state of Missouri. We only have 4 counties, which translates into getting the least amount of funding, but we certainly do the best we can and people get the bang for their buck. So the goal of the area agencies on aging across the state is to make sure that people over the age of 60 have access to programs and services that can keep them living independently and with dignity. And the goal mainly is to keep people in their homes as long as safely possible. Next slide, please. So right now, all of our senior centers are closed. Some of the senior centers across the state are starting to open a little slowly, but our 7 senior centers are still closed. We have to make sure that it's 100% safe to open those centers because on a good day in Joplin, we'll have 95 seniors at the center eating lunch, and they're crammed in together. There's no social distancing possible, so we are going to remain closed until we know for sure that it's safe. But when they are open, they do provide a hot lunch that is approved by the USDA. They provide the list of foods that we can provide, and then we create the menus off of that. And we do repeat some. Taco salad's always a hot day at the senior centers, and the oven baked chicken are always a good day. But we do try to change it up and give as much variety as we can. Another great thing about our senior centers is the activities that they provide. So there's billiards. Every single senior center has at least one pool table. And let me tell you, some of those seniors have really vicious pool tournaments, but they're very proud of them. They do very well. They even do trophies and presentations. So it's pretty serious business. And there's even some that travel to different senior centers across the state. So it's really neat. Then there's also dominoes and cards, board games, if they have some available that particular day. Excuse me. And even some of the seniors will bring their knitting or their little crafts, and they'll just sit after lunch is over and visit, have some fellowship as they're just twiddling with their crocheting and everything. There are exercise activities. So there are exercise classes. So we have a collaboration with the YMCA, so they come in and provide organized classes. There's yoga, there's Tai Chi, there's better balance. So there's some neat exercise, but there's also just some treadmills and elliptical machines that if a senior just wants to go spend 30 minutes on their own, they're more than welcome to do that and get some activity there. They also provide lectures and classes. So some will do what's called a lunch and learn, and during the lunch hour where everyone's eating, they'll have an organization or an agency come in and discuss what services that they have that would benefit the seniors. And then most of the senior centers have their dances twice a month or once a month for some of them. They'll have little potlucks on the weekends just to keep people engaged socially. And that's what's really important about the senior centers, is that social engagement. Please. And a big chunk of what we do is also the home delivered meals, also known as Meals on Wheels. They are delivered from the 7 senior centers or from our central office, depending on where they live. They are USDA approved frozen meals that can be warmed up in the oven or in the microwave. And I will tell you that if we get a shipment that damaged in some way that we can't send to a senior, we get to partake of that as staff. And you would not think that an egg roll cooked in the microwave would be good, but it's delicious. So the meals that we have now are just really top notch. And we also have a collaboration with Ozark Food Harvest, where they will get donations of produce or pastries or milk or bread, and we are able to add those to the homebound meals that we are delivering, so that the senior just doesn't get their little meal and their little half gallon of milk. They get produce, and they get some really good nutritious foods that they can eat on for the rest of the week as well. And then other donations, we had Joplin School District contact us last, not able, they were donating that to us. And that picture up there is the one of the boxes that we were when we got that delivery. So that was really great. And another thing about the home delivery, that person delivers the meal. That is sometimes the only face that that senior will see for that day or even that week. For need very desperately. But when you're homebound, you can't even get out to go to the grocery store, seeing a friendly face really goes a long way. Next slide, please. Can we get the next slide? Oh, there we are. Okay. Thank you very much. So the in-home services is part of the family caregiver services. I used to be the caregiver coordinator. Just recently, I was resource development specialist, but I was the family caregiver coordinator for many years. And one of the things we provide is respite for caregivers, and this is 60 and they have to be a caregiver living with their care recipient. We can contact home health agency to come in and provide a few hours a week. Friends, that's their time to kind of recharge their batteries. And with the personal bathing care, again, it's a contract with a home health agency where if someone cannot get in and out of the tub easily, or they just would feel better having someone there in case they fall, we can send in a personal bathing aid through a home health agency. And similar with the temporary housekeeping, that is for someone who has recently fallen, or they're coming out of the hospital and they're recovering from some kind of acute illness or acute event, and they just need a few months of some housekeeping until they get back on their feet. You know, when you're recovering from a broken leg, you can't run the sweeper. We also work with the Alzheimer's Association to provide support groups. They are not available right now, but they are doing them online. The closest one is in Monette, and I do have that contact information that I'm happy to give anybody if they are interested. You are welcome to email me or call me for that. And then sometimes a caregiver just needs a sympathetic ear, and they're dealing with a particular situation that they cannot figure out. And our new caregiver coordinator is Megan, and she is just fantastic. She will listen, she will work through that particular event and try to solve an issue if you're having one. Sometimes we just need to vent, and she's really good at being able to do that. Next slide, please. And then the other services we provide is Medicare counseling. We explain the different parts of Medicare. We also do Part D enrollments, which covers medications. We do a lot of information and assistance. So if someone calls with a question about transportation or whatever, home repairs, we can give them that information. We also have the Silver-Haired Legislature, which is a mock legislature of seniors who we have representatives, we have senators. We actually go to the Capitol building and we act it out just like we're the real legislature. Not doing that this year again because of COVID, but we're doing it virtually, so that'll be an experience. The Ombudsman program is an of nursing homes. So if someone has an issue with the nursing home they're staying in, that ombudsman is kind of a mediator to try to get that issue resolved. We also work with Legal Aid of Western Missouri to provide legal services to seniors who need them. We contract with transportation in the area. We have TATS up in Lamar. We have the Carthage Police Department over in Carthage. We have OATS, which is more of the rural areas. And then we have the Sunshine Trolley and MAPS in Joplin. We also do education programs. So the chronic disease programs that a lot of people are doing, we do that. We're also trying to do some things virtually, which we're figuring out on the fly, like everyone else is, senior budgeting and things like that, kind of a trial and error thing. And then we also provide the Better Living, which comes out in the Joplin Globe the first Friday of each month. It's got a great selection of information, different articles, different schedules of activities that are going on around the area. If you don't get the Joplin Globe, we are more than happy to mail you a copy, or you can come in and get a copy because our central office is open. Just let me know and I'm happy to pop that in the mailbox and you can get it and get a lot of great information. Next slide, please. And this is just a little blurb about the fundraiser we're doing right now. We normally have a big fundraiser with a live auction and a silent auction in the fall, and because of COVID, we are not able to do that. So we have an online campaign going, and I just wanted to throw that out there. that the senior centers and the area agency on aging provide so much more than a meal. Yes, it's that physical nutrition, but it's also that human connection that and also when people get meals, they are more likely to get contacted with other resources in the area that they need, either through us or through other agencies that provide transportation or home repair or some financial assistance with prescriptions. Next slide, please. And that's it in a nutshell. Here's my contact information, and you are more than welcome to let me know if you have any more questions or need any information from me. And thank you so much for inviting the Area Agency on Aging to speak today.
Thank you so much, Charlotte. I really appreciate and am encouraged by all the different services that you are providing to our seniors. I do want to say that, you know, with any virtual format, there are some connectivity issues that we're kind of working through here. So thanks for hanging with us. I will ask that anyone who besides the speaker who has their video on, if you would kindly turn that off, that might help a little bit with our connection. And if you have questions specifically for Charlotte, you can enter those in the Q&A box that Kristen mentioned, and we will have some time at the end of the program to address those. So thank you again, Charlotte. That was great information. So now I would like to introduce our next speaker, Diane Hall. Diane Hall is the Associate State Director of AARP of Missouri. Hi, Diane. I appreciate you taking the time to be here, and I'm gonna just turn it over to you.
Hi, and thanks so much for having me. As Melissa said, I'm Diane Hall, and I work for the AARP Missouri State Office. We have about 720,000 AARP members in Missouri and a population of over 2.2 million who are age 50 and older here in Missouri. As an AARP state office, we work really hard to try and improve the lives of our members and the 50-plus population in general. And to do that, we work on a number of issues. We work on some lifestyle issues like healthy living programs and staying sharp brain health programming. We do pocketbook issues like intervening in electric utility rate cases. And our efforts help save ratepayers in Missouri through denials of rate increases. We have caregiver issues like education and outreach that helps caregivers form a team and find access to resources. And we work on housing and mobility issues, providing information on changes people can make to their homes, changes that can help prevent falls so they can remain living at home as long as they choose. And this is where AARP's work meets falls prevention. It's in a program we call HomeFit. HomeFit delivers practical information to people about making the home safer and more comfortable for everyone as we age. And we recognize that not everyone who is 50 plus is in the same place in their lives. Some are just starting to plan for retirement. Others are retired and do the things that they love already. And there are also people who are kind of in between. They may be planned for retirement, but circumstances have changed. And then there are some people who are 50 plus who have older relatives that they're looking out for. Now, wherever you and your loved ones are in this journey, HomeFit has good information on preventing falls and making your home safer as you age. AARP's research shows that nearly 90% of people aged 45 and over want to remain in their current home and community for as long as possible. Very few people, as you might imagine, say, "Ooh, I want to move into a nursing home or even into independent living." They want to stay connected to their community with their friends and their family. But the reality is only a few people do anything to prepare their home to meet their needs as they age. And one of the main considerations is falls prevention. To help people prepare their homes or the home of a loved one so that they can live there safely for as long as possible, AARP offers HomeFit. Now, the HomeFit in non-COVID times would be an interactive presentation where everybody was in person and we talk about all the home modifications. However, in today's situation, the HomeFit Guide, it's a free publication that you can request from AARP. It's such a good resource. You can easily move forward without the workshop. Don't tell anyone from AARP I said that though. HomeFit can help people develop a plan, a short-term plan or a long-term plan or both that fits their needs and their budgets. We have a checklist called Is My Home Fit? And we encourage you to go through your home or that of a loved one to start making a list of improvements that you can make to the home so it's safer and more comfortable. I've given Extension an electronic copy of the Is My Home Fit checklist, and I'm hoping that they can share that with all of you. The larger Home Fit Guide has both small and large makeovers that can help you or a loved one to age in place. If we start planning now, we can stay in our homes longer and more safely. Another checkup tool that is out there is our Preventing Falls checklist, and I've given Extension an electronic copy, which I can't seem to say. I've given them an electronic copy of that one too. The Preventing Falls checklist is similar to the Is My Home Fit checklist, but it has more specific safety improvements on preventing falls, as you might imagine. To prevent falls, there are some simple, helpful safety improvements that don't cost a lot of money that Home Fit recommends. Here are a few that you could start thinking about. The first is to create at least one step-free entrance to the main floor of your home. Now, some folks who have a ranch house may already have this, and you're lucky if you do. But this can be as simple as buying a portable threshold ramp. These are available online and in most home improvement stores. Something I'd say to keep in mind, though, is although the aluminum ramps are a lot less expensive, they are not as secure, particularly on concrete, as the rubber threshold ramps. So you want to be careful about that. Another thing to prevent falls is getting rid of throw rugs, electrical cords, and uneven or high carpets that are trip hazards. Getting rid of those can prevent falls. And that sounds easy, but I can remember that the arguments that I had with my mom to get rid of her pretty little throw rugs. Another thing is getting rid of dark areas in your home. Add light everywhere, including night lights. Make sure all of your stairways are brightly lit. That is very important. And having light switches within easy reach can also help you prevent falls. And that sounds logical, right? But how many of us have a light switch where you have to reach over the back of a couch or reach around a lamp or plant or something to reach that light switch? Another thing is, how many of us have to walk a couple of steps into a room that's already dark to get to the light switch? Making sure that you have a way to light a room without having to go through hazards or walk into a dark room can really make it safer and help prevent falls. Something we all know about, but it's also recommended by the Home Fit Guide, is installing grab bars in the bathroom. That can prevent serious accidents. 70% of all in-home accidents occur in the bathroom. Now, most grab bars should be installed horizontally, but they're only as strong as what they are attached to. So grab bars must be attached to studs so it can bear your weight. And if you don't know what a stud is, a wall stud, then you need to get somebody else to install your grab bars for you. Grab bars are widely available at most home improvement stores. Now, these modifications and many other ideas are part of the new and still free Home Fit Guide. The Home Fit Guide takes you through your house step by step and room by room, and it'll assess your needs and help you plan the changes that you might need to make. If you'd like the new Home Fit Guide, you can call AARP's toll-free number. It's 888-687-2277. That's 888-HOUR-AARP. And when you request the new Home Fit Guide, make sure and give your title of the publication itself, which is AARP's Home Fit Guide, and then the number of the publication, which is D78959. I highly recommend the Home Fit Guide as a tool that'll help prevent falls. Now, you can also get a free copy of this online. You can download a digital copy, or you can just look at it online, or you can order a hard copy at aarp.org/homefit. And the benefit of that is going straight to the guide without going through all those toll-free number prompts that nobody likes. It's a great guide. It can help you plan to have a safe home for as long as possible. And if you're not doing it for yourself, it can also help you prevent falls in the home of a loved one. And if you'd like more information about what AARP Missouri is doing, and a lot of it is online right now, please go to aarp.org/Missouri. I want to thank you for having me on today. I think preventing falls is so important, and the Home Fit Guide is a great resource to do that. Thank you very much.
Thank you so much, Diane. I really appreciate all those tips that you provided. Sometimes it seems so simple, but it's just becoming aware and taking the time to make those changes. So thank you for for your talk, and the checklist that you mentioned, we are going to make those available on our main landing page for this webinar. And so we can link that in the chat as well. So thank you again. All right, so our final guest today comes from the Oasis Institute in St. Louis, Missouri. And I would like to welcome Marissa Sandboth, a project coordinator for this organization. Marissa, hello, thank you for being here.
Thanks for having me.
You're on, go ahead and just tell me when you would like me to advance. There may be a little lag time, so I apologize for that.
You're okay, no worries at all. So like Melissa said, my name is Marissa, and I am a project coordinator with Oasis. So I am an occupational therapist by trade. So my primary focus within Oasis is fall prevention and exercise. So yeah, we're really excited about the National Fall Prevention Awareness Week. Okay, you can go on ahead, thank you. And then if you don't mind going through the bullets. Perfect. So Oasis, we are a nonprofit organization based here in St. Louis, but we actually have 9 partner sites across the US. So we range all the way from Rochester, New York, and we go to San Diego, California. And through these different centers, we're able to offer different classes and different volunteer engagement, which I'll talk a little bit more about as we continue to go along. But we have loads of different partnerships, around 800 nationwide, and we're partnering through at least 26 different states and of course more than 50 US cities, which is really exciting. And then, like I said, we help promote healthy aging through lots of different lenses. My particular focus is within that health realm, but we also have some volunteer engagement as well as lifelong learning. Okay, next slide, please, Melissa. Yeah, so again, just kind of another nice visual to show our three-prong approach. Again, lifelong learning, and then active lifestyles, which is where I fall under, and then volunteer engagement. Next slide, please. Yeah, great. Yeah, sorry about all these bullet points. Okay, so lifelong learning, of course, is exactly what it sounds like. We have the education for all the way things from art history to technology, philosophy. We have several roundtables for people within different communities. And this is just a really great way to continue learning within different areas of interest. We have lots of different subject matter experts come in and speak about these. And it's really exciting to kind of see people get ramped up. One of my personal favorites that we have is one about the history of chocolate, and the person who comes and speaks and teaches helps bring in lots of samples, which is one of my reasons it's my favorite. Okay, next slide, please. Okay, so within community involvement, this looks can look lots of different ways. So one particular is our tutoring program. That's a great way for volunteers to be engaged. We have over, I think, 25,000 students that we've served through the tutoring program, and we do this throughout the state of Missouri within our local St. Louis chapter or network site, but of course we have them at our other network sites as well. They partner with several different school districts and go in and typically tutor students around grades 3 and 4, and they help with reading and literacy. So that is that intergenerational tutoring. We also engage a lot of different older adults within the classes that we help teach and engage. So we have people, a lot of older adults teaching our classes. There are a lot of our subject matter experts teaching, specifically with nutrition and exercise. They do a lot of peer leaders where we do peer-to-peer conversations. Obviously with COVID, those have been skyrocketing with the technology aspect, so either Zoom or via telephone. And then we also, of course, with administrative support, so just within our network sites. So we help. We have, I think, what was it? We have over 395,000 hours of volunteer engagement in Oasis across the nation. So we're really excited about that. Perfect. Move to the next slide. So one of the reasons we focus so much on volunteer engagement is because there's a lot of different benefits. So of course our classes, we love and are passionate about our classes, but we know that it's twofold, right? That if we engage people to teach and to volunteer, that there's just the benefits, we can just, it's a ripple effect. And we're really excited about that. So some of them include preventing isolation and depression. They help promote a healthy physical activity, especially when we get older adults engaged in volunteer roles within exercise and education about health and exercise. Help bridging the generation gap, again, primarily with the tutoring, but helping people engage with lots of different ages and find purpose within that. Improving mental health and that emotional health, and it actually lowers mortality rate. So we're really, really excited and proud of our volunteers. Next slide, please. So for active lifestyles, again, this is kind of my particular area that I work within. So all of our exercise programs are either evidence-based or research-informed. So they, a lot of them help and promote functional activity or better balance, just a lot of things that are really important and we know are crucial as we age. So that's really very much in the same vein as fall prevention and that functional ability. So, so those are more of our exercise classes, and then we hold workshops which help a lot more with that education and promotion of health. So we have a chronic disease and diabetes self-management programs. A matter of balance. We have several one-time health classes where we have a lot of physical therapists or occupational therapists come in and speak about different topics, kind of like what's hottest in fall prevention, and then a lot of health seminars, and then as I was speaking about the exercise programs. Next slide, please. Okay. And then one thing, this is just a small plug, we're really excited about this. It happened very serendipitously to coincide with COVID. This was like our silver lining of COVID, but we just launched a new site called Oasis Everywhere. So it is what we're considering an exclusively virtual network site. So again, we have 9 across the United States, but this one is a great way for people who don't necessarily live within the states or the cities where we have already our Oasis, like brick and mortar, network sites that you're able to engage still virtually. So this is something even past COVID, we plan to continue and to encourage people to participate in. Our hope and our goal with this is to bring kind of the best and brightest programs from all of our network sites across the United States. And we're putting them on this platform. So again, all the things ranging from exercise to lifelong learning to health, education, we really kind of cover the gamut and did our best to anyways, to really provide a lot of comprehensive class opportunities. And the hope and the goal was to make it accessible for people regardless of geography. So if you live in a very, very rural area and you're unable to get to a nearby site, or perhaps you are homebound or unable to find appropriate transportation. Yeah, we're really excited about this. So you can visit us at oasiseverywhere.org, but also at the end of this, I have my email. So feel free to shoot me an email if you have any questions. So yeah, we're really jazzed about this. Okay, next slide, please. So I'm just going to take a couple minutes to talk about some of our primary evidence-based programs that we have. And this is actually one of the ways that we partner with UME is we help statewide host a lot of different evidence-based programming, and Matter Balance is one of those. So currently with COVID, we are unable to engage in this virtually. I know that there are some people still holding it in person. Oasis within St. Louis, our numbers are still pretty high, so we are doing everything virtual. But what it is an 8-week class that addresses the fear of falling. There's a lot of education on fall prevention. Specifically, we even have a physical therapist or occupational therapist come in and give therapy-specific recommendations. We talk a lot about home modifications, even like a cognitive restructuring aspect that helps everyone learn more about self-advocacy and really truly that fear of falling and how we can best address that. And then this is another way that we help engage older adults, because we oftentimes, the facilitators are people themselves who have perhaps had a fall in the past, or fall prevention is really, really important to them. So this is a great program, and we're hoping this spring to bring it virtually, but yeah, it's currently we're not able to hold it in person. All right, next slide, please. Another evidence-based program that we host statewide with UME is Tai Chi for arthritis for fall prevention. So it is evidence-based to help address, no surprise, arthritis and fall prevention, which is really exciting that this, there's this exercise program, there's, but also this beautiful practice and mentality that ties along with it. Typically when people try Tai Chi, they end up loving Tai Chi, and it's something they practice for years and years to come. So this is something that we find is very successful and very of interest to a lot of people. It helps also with, we have found and had reports, I know it's not in the title, but that it helps also with joint pain and just general pain reduction, which is exciting. So we have them all over the St. Louis area. I know UME does a great job of having classes throughout mid-Missouri, and then we also, of course, have Tai Chi available virtually right now. Okay, next slide, please. And then Extra Start, which is, again, not evidence-based, but it is an OASIS-developed, research-informed exercise program. So it's designed for any older adult who is 50 and up. It is a good foundational exercise program. Some is done seated, some is done standing. It's a good mixture of cardio and balance and flexibility. We use this as a great way to kind of get people engaged with exercise. Like I said, it's a great way to build up. And this is often the class we recommend if people come to us and say, hey, I really want to get engaged with exercise, but it's been a while since I've really been doing any routine exercise practice. This is just a great way to kind of get in and get started. And there's some music, and I know there are people who've been taking this class for 10 years, have their cohorts and absolutely love it. Again, available virtually, not on OASIS Everywhere currently, but we do have one running locally in St. Louis. But with COVID, everything being virtual, you don't have to be local to take it, which is kind of a plus. And then next slide, please. And then just another small plug about some of our one-time classes. Primarily, these are for health education and promotion, ranging from urinary incontinence to home modification to how do you prevent osteoporosis and what are the general do's and don'ts. It truly, really try to span a lot of different health topics to give people different opportunities to learn about what may be important to them. We deal with fatigue and, fighting fatigue and chronic pain, just a lot of different things of interest. So because this is a really great way to learn, and we know, virtually people may not be able to kind of commit to more longer term things, we're offering at least one health class a week. So again, that's available online if you're interested. And all of our one-time health classes are free, which is just a great, great option too. If you're looking to learn, please sign up. We'd love to have you. All right, next slide, please. Oh, yep, I know I kind of ran through them, but here's just some examples. This is by no means all of our classes. I think we have somewhere around 25 total different titles, but these are some of our more popular. So, Fit for Function, Free from Falls, Standing Tall, Tips for Posture, and like I talked about, osteoporosis. So again, we really just try to cover lots of different topics of interest. Perfect. Yeah, so thank you all for listening. Please feel free to contact me with any questions that you may have, either about OASIS in general or OASIS Everywhere. And thank you again, UME, for having me.
Thank you so much, Marissa. That was really helpful. I know I personally had no idea all that you guys were involved with your community involvement program and your volunteer engagement. And I was definitely interested in that history of chocolate program you were speaking about. So thank you again. Thank you to all of our guest speakers for sharing about their organizations and services today. It was just really great to hear all that you're doing. So now I would like to kind of hand the virtual mic over to my colleague Gina Lucas to tell us more about the impact of falls and fall prevention.
Very good. Well, we have certainly heard many times over the past several months that we are in a new normal. Our world looks much different today than it did pre-COVID. However, some things have not changed. one thing is certainly still the same, and that is falling is not a normal part of aging. This means that it's not an unavoidable occurrence. There are steps that we can take to reduce our risk of falling. Next slide, please. So communicating this information is very important to us here at the University of Missouri Extension, as we are located in a state whose rate of injury from falls was 31% higher than the national average at the time that this data was collected. And so we are determined to help older adults in our state take steps to reduce their risk of falling and therefore the injuries that result from those falls. Next slide, please. And so falls are an important thing to concentrate on because not just the injuries that we're dealing with. It's not the physical alone. It's the falls and the fear of falling greatly impacting their quality of life in many ways. Those who suffer from a fear of falling often limit their activities due to this fear. This limiting of physical activity results in a decline in their social activities. As we know, this isolation and lack of physical activity has a direct impact on a person's not only physical strength, but also their feelings of isolation and depression, as well as a general feeling of helplessness over their future. And so A Matter of Balance, the program that we use to really address this issue, is what we're going to talk about this morning. And so A Matter of Balance is for anyone who is concerned about falling. It's for you or a loved one of yours. If you have fallen in the past, or if you have begun to restrict your activities due to a fear of falling, A Matter of Balance can help. This program has been designed for older adults who want to tackle the issue while improving their flexibility, their balance, and their strength. And so how does Matter of Balance help prevent falls? So first, it addresses the actual fear of falling. The fear of falling can actually be a self-fulfilling prophecy. Because of their fear, older adults may begin to limit their activities. When they do this, this limit of physical activity directly results in decreases in physical strength, their flexibility, and therefore their balance. With this decrease in physical fitness, a person has in turn actually increased their likelihood of falling. Matter of Balance also emphasizes the importance of physical activity by incorporating strength and balance exercises into its program. And each of these exercises can be tailored based on each individual's current level of ability. And so rather than talking about physical activity in theory as something they should do, which everyone pretty much agrees with, we introduce these exercises into the actual classes in a slow, easy way that allows them to see for themselves that they can actually do this. And we reinforce that any increase in movement is beneficial, and that makes a difference. Matter of Balance also encourages improved communication and a new kind of assertiveness. And so assertiveness may have a negative connotation. When you think of assertiveness, you think of people who may be pushy or aggressive, but being assertive is not about being pushy. It's about being confident when communicating with your family and with your healthcare providers about your needs, about your concerns, and about what people can do to help you, to support you in staying active and engaged. And so rather than staying home, afraid of being a burden to their loved ones, not wanting to be a pushy person, they will avoid activities rather than ask for the love and support that they need to continue to be active with their family. So Matter of Balance also helps identify risk factors for falling, such as medications they may be taking, changes in their prescription and their vision, changes in blood pressure they may have when they either stand up or sit down, among many others. Each of these issues, when acknowledged and addressed, can decrease one's likelihood of falling. Matter of Balance also encourages changes to one's home environment, and this has been mentioned already this morning as well. If you're able to notice that these rugs are loose, that the lighting needs to be improved, that you only have lights at the top of the stairs instead of the top and the bottom, that you need to add some grab bars, just making these simple fixes can improve a person's likelihood of not falling in their home. And so there are strategies to reduce physical hazards in the community, and that such as people who are afraid of being in crowds for fear that they were falling. We have a lot of group conversation where we discuss issues that people have run into and solutions they have found to reduce their own risk of falling. And so when we look at these barriers to change, we look at those together. And so as a part of each Matter Balance program, we also have a guest healthcare professional that joins the group to discuss safer ways to land if you find that you are falling, and also how to safely get up from a fall. And so by implementing these small changes in our environments and our attitudes and behaviors, we greatly reduce our risk of falling. And so now we would like to open up the remainder of this session for some questions that you have for either myself or Melissa, or for any of our three speakers. If you want to just insert that into your chat and we can address that. Yes, Diane, she says the 31% figure is shocking. It is. And it's something that when that first was released, we became very active about increasing our efforts to do these kind of programs that allow us to address that. And so University of Missouri Extension does a lot of Matter of Balance classes. We are performing those in person in some places. I am going to be doing one starting next week in the Gower area, that's in Northwest Missouri. I have inserted a link in our chat that has some of our other available classes and events, the Tai Chi for arthritis, the Stay Strong, Stay Healthy, we are doing virtually as well as in person when the social distancing is available. But yeah, lots of things that we can do to help decrease those numbers. Do we have any other questions or comments?
Gina, I wanted to add, can you hear me okay?
Uh-huh.
We had a question earlier. Someone asked, can an area agency on aging also advise individuals on obtaining Medicaid help? And I just wanted to let everyone know the answer to that was that an area agency on aging can assist with the Medicaid application as a courtesy. However, after that application goes into the state, they cannot help beyond that. I just want to let everybody know about that question. That's a great question.
Okay, and so we have a question, how do we know if inner ear issues may be causing the balance problems? Do we have anybody who wants to address that question?
I would go ahead and just say that you would need to definitely get that checked out by a healthcare professional. They're really going to be the only person who can help with that. We're not trained doctors, so, but that is
right.
That inner ear issues can cause balance problems, so that is something to be aware of.
Yeah, and throughout the Matter Balance program, we say this could be an issue. You need to talk to your doctor about it. And so if you stand up and you get dizzy, you need to talk to your doctor about that. That may be a blood pressure. We're not diagnosing that is the issue, but these are things that have commonly become problems. If you're having problems seeing, if you've just moved to a bifocal and your regular glasses have never been bifocals before, that can be an issue. And so we would recommend that you talk to your eye doctor about that. If you're having changes in your medications and you've noticed since then you have some balance issues, that's when we say you go ahead and talk to your pharmacist. And so the good thing about these classes, it'll be when we bring up things you may not have thought of, but then we do refer to an actual healthcare provider to diagnose that it is an issue for you. But yeah, inner ear issues will cause some balance problems.
We have a question in the Q&A, and I believe this was for Diane. So
okay.
The participant's asking, did I hear correctly, grab bars should be mounted horizontally? If so, what is that reason?
Absolutely. I was just typing the answer to that, but I can answer it live, easy enough. One of the reasons for that often are, first of all, size to meet the standard spacing between studs. The other part is, and you see this in some hotel rooms, because their studs are maybe a different width, that they're kind of at an angle, at a 45-degree angle. And that's not horrible, but you're more apt to let your grip slide down that pole than you would if it's a horizontal oriented grab bar. And there's a lot more about this in the Home Fit manual, and I encourage you to order that because it's free, and why not?
Thank you, Diane. That was a great explanation. And these are fantastic questions. Keep them coming if you've got them. We're here for that.
Do we have any additional questions? Okay. I do want to go ahead and, if we don't have any, remind you of what the additional sessions are for the remainder of this week. That for Falls Prevention Awareness Week, from noon to 1, all week long, we are doing different topics. We will have different guests. And so tomorrow we are talking about staying active, talking about some programs that we have to do that and why that's so important. On Wednesday, we will go into more depth on keeping your home safe, which would include some of those things we mentioned today. On Thursday, we're going to be talking about brain health and maintaining that brain health. So you'll want to check in with that. And on Friday, we have do medications affect your balance? And we will have some pharmacists talking with us with that decision as well. Are they? I don't know. What do you, I don't have the answers to some of these questions. Are they going to get grants to teach Tai Chi? Kristen, do you know anything about that?
We currently have a grant. University of Missouri Extension works on a grant with Marissa and the Oasis Institute for the state of Missouri, and that is a grant funded program. I believe we will try to work together again to offer that because everybody has loved Tai Chi, so we're going to hopefully keep that going for everyone. Be on the lookout. And then we have a question about the address for the Home Fit manual. Diane, I believe that's a question directed at you.
I'm sorry, you're a little bit fuzzy. Something the Home Fit manual?
I'm so sorry. The address for the Home Fit manual, someone is asking. How do they do it?
You can call our toll-free number, which is 866-HOUR AARP, and you can order it that way, or you can go online. Now, see if I can remember the website without looking at the paper. You can go to aarp.org/homefit, I think, and there's an order form on that site, or you can actually download the PDF. Answer the question?
I think that's correct. I have just put that link in the chat box if you guys are interested in that, and that way that might save you a few steps.
I should have thought of that.
That's okay, I'm not.
And so, Kristen, if they're not able to make all of the sessions, where will they be able to find this information after the fact, or if they want to rewatch any of the sessions?
Yes, that is a great question. So we have a page dedicated to the webinar series, and we will post the recordings along with hopefully any documents or web pages or anything that was referenced within this session. So hopefully we'll have everything ready to go, but I will put that link in the chat here. We're also going to email it to you just so that you have it on hand. But let me get that really quick. And other than that, thank you all.
We do have a hand raised. I don't know if that's for a question or if it was an accident. Margie has her hand raised. You have a question?
I'm going to allow you to talk, Margie, if you want to. You can unmute yourself unless you accidentally.
Yeah, your program, I don't know. When I do them with the cyber seniors, it's always at the bottom and you can unmute yourself. I found it kind of hard to get in on yours. They just send you the link and you just link in. But with yours, it's a little bit more, it was a lot more challenging. But Yeah, I took some of these before. That's how I'm an intermediate Tai Chi person now from they did it years ago at the public libraries in St. Louis, but they're not, because I keep telling people about it, but they're not bringing that back, right?
That might be a Melissa question.
Yeah, you still there?
Yes, hi, sorry. I am still here. I didn't know if you were asking specifically within St. Louis. So currently we are running the Tai Chi classes virtually, not necessarily in partnership with the city or county libraries right now. That may change as things, we're all kind of flying by the seat of our pants with
Yeah.
some of the COVID related structuring. But
Well, I get that, but are they going to have them free? Because I was like, well, it's free. I don't know what this stuff is. And that's how I started doing it. Because people said Tai Chi, and I don't know, maybe other people are different, but I don't sign up for stuff that I don't really know much about. So,
that's a great point. Currently, Tai Chi virtually is fee-based, but we have partnerships with different grants kind of throughout. Like if you live in the city of St. Louis, we are working on discount codes so people are able to get the class for free. But currently it is fee-based, and we're working on having as many either discount or free opportunities as possible.
well, are there more falls in the city versus the county?
No, not necessarily, but there is a specific tax in the city that passed to help provide programming for older adults, where it did not pass in the county. It was up for, up on the ballot a couple years ago. So that's just where that additional funding comes from within the city of St. Louis.
Because when I took one of these fall classes, the physical therapy lady said that you can fall on the grass, because people think, oh, that's okay, I'm walking in the park, but all the soil is it's uneven. It doesn't look uneven when you look at it, but when you walk on it as you age with your inner ear issues, that's where a lot of people, she said they were on vacation. She must have been like in her late 40s, early 50s, and she said, here we are walking on this ground looking at sites. I don't know if it was a battleground or what, but she said she fell. So and they mentioned too, they didn't really go over it that much in this, which I thought they would do. But when you're tired, like she said, here we are on vacation, so you're not sleeping that well. And then if you're hungry, you're kind of running on a crazy schedule on vacation, so you're not eating properly. And then you're dehydrated, you're thirsty, and then you're looking around and not paying attention really to what you're doing because you're taking in the sights. So I found that very helpful. And also too, when you're stepping off and up on a curb, it's hard to see if it hasn't if the color of the curb blends in with the street. So it just made me, and now as I've gotten older, now that's why I took this again, because I thought, well, what else did they say that I cannot remember?
Great points, Margie. Thank you for sharing.
But and people I told to take this, a lot of them were retired teachers, they did not take it. And they ended up falling. This is a couple years ago, and they had to have surgery. One tripped over tree roots at a boat dock, I don't know, and they mentioned that in the class, look out. And one was just walking in her neighborhood and tripped on the sidewalk.
My goodness, see, this is the real reason that we need to be bringing awareness to this. Thank you so much for sharing, Margie. Thank you everyone for joining, and please feel free to join us again for the rest of the week. Again, we have more sessions from noon to 1, so we're going to go ahead and cut this off and get you guys back to the rest of your day. Thank you all.
Thank you.